If you've ever woken up in the middle of the night unable to move, if getting out of bed in the morning feels like your spine has turned to concrete overnight, I need you to stop scrolling and listen to me for the next few minutes. Because what I'm about to show you might be the single most overlooked reason back pain gets worse as we age. And it has almost nothing to do with your mattress, your posture during the day, or the chair you sit in. It has to do with what happens to your spine the moment you fall asleep. Every single night while you're resting, your spinal discs are doing something remarkable. They're rehydrating, expanding, and resetting. But for millions of people over 60, one simple common mistake is undoing that entire process before it even finishes. And by morning, that undone work shows up as stiffness, shooting pain, or that awful stuck feeling when you try to stand up. Stick with me, because by the end of this video, I'm going to show you the one stretch, done at exactly the right time, in exactly the right way, that could change how your back feels every single morning. I'm Dr. Ethan Brooks. I've spent years working with patients in their 60s, 70s, and 80s, helping them deal with exactly this kind of chronic, nagging back pain. The kind that doesn't come from one big injury, but from decades of small, repeated stress. Here's what I've seen over and over in my practice. The people who make one small change to their nighttime routine consistently report feeling noticeably better within just a couple of weeks. Not because of some miracle cure, but because we finally addressed the actual mechanical reason their back was tightening up overnight in the first place. I think of patients like the woman I'll call Margaret, a retired school teacher in her late 60s who told me she'd basically accepted that stiff, painful mornings were just part of getting older. Once she understood why it was happening and adjusted one habit before bed, she described her mornings as night and day, different within about 3 weeks. That's the kind of change we're talking about. So let's get into the science. Why your spine suffers at night. Here's what's actually happening in your back as you age, and it's important you understand this because it's the reason the stretch I'll show you later works so well. Your spinal discs, the soft, gel-like cushions between each vertebra, don't have their own direct blood supply the way muscles do. Instead, they rely on a process called imbibition. Fluid moves in and out of the discs based on pressure changes throughout the day. During the day, gravity and movement compress your discs, squeezing fluid and small waste products out. At night, when you lie down and take pressure off your spine, the discs are supposed to slowly reabsorb fluid and rehydrate, like a sponge expanding after being wrung out. This is a well-documented phenomenon in spinal physiology, and it's actually part of why people are measurably taller in the morning than at night. But here's the problem. As we get older, several things interfere with this natural nighttime reset. The discs themselves lose water content and elasticity with age, making rehydration slower and less complete. Tight hip flexors and a shortened psoas muscle, common after years of sitting, pull the lower spine out of a neutral position, even while lying down. Weakened core and back-supporting muscles fail to hold the spine in the right alignment for the discs to fully decompress. The result? Your discs never fully reset overnight. They stay slightly compressed, slightly dehydrated, and slightly misaligned, night after night. That compounding effect is a big part of why so many people over 60 wake up stiffer than they went to bed, and why that stiffness tends to get worse over the years rather than better. Now, before I show you the fix, I need to walk you through the mistakes that make this so much worse, because chances are you're doing at least one of these right now without realizing it. Mistake number 1, sleeping flat on your stomach. The scientific danger: stomach sleeping forces your lower back into hyperextension for hours at a time and rotates your neck to one side. This combination keeps the lumbar spine in a compressed, twisted position exactly when it should be neutral and decompressing. The research pattern. Physical therapy literature consistently identifies stomach sleeping as one of the sleep positions most associated with increased lower back and neck complaints, compared to side or back sleeping with proper support. The patient story. I had a patient, I'll call him Robert, a retired contractor in his 70s, who'd slept on his stomach his entire life. He couldn't understand why his lower back pain never improved no matter what daytime exercises he did. The moment we addressed his sleep position, along with the stretch I'll show you shortly, his morning pain became far more manageable. Mistake number 2, skipping any pre-bed movement entirely. The scientific danger. Going straight from an evening of sitting, dinner, TV, reading, directly into bed means your hip flexors and lower back muscles are tight and shortened right at the moment your spine needs them relaxed to decompress properly. The research pattern. Studies on prolonged sitting consistently show it shortens and tightens the hip flexors and psoas muscle over time, which in turn pulls on the lower spine and disrupts natural spinal alignment. The patient story. Think of someone like Linda, a 66-year-old who spent most evenings in her recliner before heading straight to bed. She assumed her back pain was simply arthritis. In reality, her hip flexors were so tight from all that sitting that her lower spine never had the chance to fully release at night. Mistake number 3, using a pillow setup that doesn't support spinal neutrality. The scientific danger. Whether it's too many pillows, a pillow that's too flat, or no support between the knees for side sleepers, poor pillow setup keeps the spine subtly twisted or misaligned all night long. The research pattern. Sleep ergonomics. Research consistently shows that maintaining a neutral spine position, hips, shoulders, and neck aligned, significantly reduces overnight muscular tension compared to unsupported positions. The patient story. One gentleman I worked with in his early 70s was a lifelong side sleeper who never used a pillow between his knees. Once we added that single adjustment along with proper stretching, his hip and lower back pain became far less frequent. The one stretch, now for what you came here for. The solution, the supine knee to chest with pelvic tilt, the scientific benefit. This stretch does 2 things simultaneously. It gently lengthens the lower back muscles and hip flexors while encouraging a posterior pelvic tilt, which helps restore your lumbar spine to a neutral position right before the hours your discs need to decompress. It's a foundational movement recommended in physical therapy for lower back pain relief precisely because it's low impact and safe for most people, including older adults. The research pattern. Physical therapy guidelines consistently list gentle knee-to-chest stretches among the safest and most effective mobility exercises for chronic lower back stiffness in older adults, precisely because they don't load the spine the way standing stretches can. How to do it. 1. Lie flat on your back on your bed, knees bent, feet flat on the mattress. 2. Slowly draw one knee toward your chest, using both hands to gently pull it in. You should feel a mild stretch in your lower back and glute, never pain. 3. At the same time, flatten your lower back gently into the mattress. This is the pelvic tilt. 4. Hold for 20 to 30 seconds, breathing slowly and deeply. 5. Release, then repeat with the other leg. 6. Finish by drawing both knees to your chest together for a final 20 to 30 second hold. 7. Do this entire sequence 2 to 3 times, right before you turn off the lights. Important safety note. If you have a diagnosed disc condition, recent spinal surgery, osteoporosis, or any sharp pain during this stretch, stop and check with your doctor or physical therapist before continuing. This is general guidance, not a replacement for personalized medical care. I've watched patients go from dreading their mornings to genuinely looking forward to getting out of bed pain-free, simply by making this 2-minute habit part of their nightly routine. Now, if this is the first time you're hearing about how your spine actually resets overnight, I want you to do 2 things for me right now. First, hit that subscribe button. Every week, I break down exactly what's happening inside your body as you age, and more importantly, what you can actually do about it. Not vague advice, but specific, actionable steps. like the one I just showed you. Second, comment below and tell me, what time do you usually go to bed? I read every comment, and I want to know if this stretch makes a difference for you. Come back in a week and tell me how your mornings feel. Here's what I want you to remember. Back pain isn't just part of getting older. So often, it's the result of small, fixable, everyday habits. The way we sleep, the way we sit, the way we move in the hours before bed. You don't need an expensive mattress, a chiropractor 3 times a week, or a medicine cabinet full of pain relievers to feel better. Sometimes, it's a 2-minute stretch, done consistently, at the right time. Your back carries you through every single day of your life. It deserves 2 minutes of care before you close your eyes tonight. If this video helped you, share it with someone you know who complains about their back every single morning. You might change their life the way I've seen it change so many of my patients. Subscribe, hit that bell so you don't miss next week's video, and I'll see you in the next one.